who is the policy director of the Children's Cabinet, for what's going to be a great couple of thoughts up top and turn it over to Commissioner Harpstead to do the same, just because this topic is so critical to our economic growth in the state. There is not a day that goes by where I don't hear from an employer in one way or another about how important childcare is to our economy. And of course, this pandemic has raised those issues for all of us even more pressingly by the day. I myself am a parent of two 4-year-old twins, and my wife and I have juggled childcare like the rest of us over this last year, kids bopping into Zoom meetings and trying to find carryover care and substitute care when things go sideways. And so it's been just a year where every parent's had to figure this out. And even before the pandemic, of course, Minnesota had major challenges when it came to childcare, particularly in greater Minnesota. We are about 80,000 slots short in the state of Minnesota for childcare right now, and it is one of the governor, lieutenant governor's big goals for their administration to drastically increase the number of slots we have in Minnesota for kids through creating more quality childcare. In fact, the goal very specifically is to increase the proportion of families who have access to childcare by about 20% in our state. That would mean creating an additional 18,000 slots of childcare, which equates to approximately 620 new family childcare providers and about 140 new childcare centers if we're going to meet that goal, given the current distribution across the state. So here at DEED, we've made this a big area of focus. We have a childcare economic development grant program that helps entrepreneurs and would-be providers of childcare start those businesses up, get the technical assistance they need, get the support, get kind of that back office, business generation consulting that you need to really start a business. This program is really successful. It creates thousands of slots every time we're able to make those grants. So a big part of our ask this legislative session is for more money for that grant program. And then we're also looking to ways to make our existing system more flexible through the Workforce Development Fund, putting more dollars towards childcare, for example. And just last Friday, we announced a new partnership with First Children's Finance, an extraordinary organization here in Minnesota that's partnering with our small business development centers across the state to provide some consulting to businesses who are starting in the childcare field across Minnesota on a regular basis through those small business development centers. Again, just giving providers what they need to get started and up and running from a business perspective. So we're excited for this conversation to learn more from our experts. And I'm also pleased to turn over to my co-host, Jodi Harpstead from the Department of Human Services, for some opening thoughts as well. Commissioner Harpstead, over to you.
Good afternoon. Thank you, Commissioner Grove. On behalf of everyone at the Department of Human Services, thank you for inviting our department to participate in the roundtable today and to listen to everyone's perspectives. I also have many, many people in the Department of Human Services who depend on childcare in order to be able to continue doing their work at DHS, including a couple of my senior staff. We're always very careful to leave them alone first thing in the morning and last thing in the afternoon when they're dropping off and picking up kids, and just appreciate everything that you've done. Particularly appreciate all the providers who've sacrificed to help Minnesota prepare for and persevere through this COVID-19 pandemic. Proud of the heroic efforts you've made to learn how to do the work in this very odd time with all kinds of new protocols in the work. Appreciate your patience and flexibility, and grateful and inspired by you and all that you had done. We're so grateful for the federal funding for childcare that Minnesota's received, and it's allowed us to provide grants to support childcare providers to ensure there's enough childcare slots to serve families and to cover costs related to ensuring children and staff health and safety. The governor's COVID education and childcare work group identified distribution of source control and critical supplies as a key response strategy early in the pandemic, and we've all worked together to develop a process for determining statewide need and dispersing supplies. Our program waivers in DHS, we hope, have been what you've needed to support children, families, and all the providers continuing to prioritize needs during the pandemic and reduce negative financial impact on families. I'll end my remarks today just by thanking the Governor, Commissioner Grove, the Children's Cabinet for their leadership and partnership in prioritizing childcare providers for testing, vaccination, continued financial support during this unprecedented year. Because childcare providers stepped up to the task of caring for and educating our youngest Minnesotans, first responders and healthcare workers were able to stay on the job where we needed them to be. And thank you so much for all you do and for who you are for the people and the children especially of Minnesota.
Great. Well, thank you. We're thrilled to get the conversation started. And before we do that, of course, we want everyone to meet our panelists. So just to make it easier here on the old video conference, I'll say your name, and if you can just give your name and organization, we'll go around the horn, and then I'll turn over to Stephanie Hoganson to moderate our discussion. So let's start with Erin Eckernacht.
Hi, that was really close. It's Erin Echternock, and I am the Assistant Director with Greater Bemidji. So we serve in an economic development capacity for the Northwest region of Minnesota.
Great, welcome, Erin. Let's go to Scott Marquardt.
Thanks, Commissioner. I'm Scott Marquardt with Southwest Initiative Foundation. We serve the 18 counties and 2 Native nations in the southwest corner of Minnesota, and headquartered in Hutchinson, and look forward to a great conversation today.
Great, thank you, Scott. Welcome. Let's go to Lydia Pietruszewski. We got some names on this call. Sorry if I'm butchering your last name.
That was great, Pietruszewski. I'm director at Pine Pals Intergenerational Learning, Childcare, and Preschool in Bemidji. We just opened November 30th of 2020, and we serve children ages 6 weeks to 12 years.
Great. Well, looking forward to hearing about your experience, Lydia. Let's go next to Jenny Holweger.
Good afternoon. I'm Jenny Holweger. I am the CEO of the Kandiyohi County Family YMCA, and we run 2 childcare facilities. The newest one opened December of 2019.
Wow, so some recent entries into the market at a very unique time to be starting childcare businesses. Thanks, Lori. Welcome. Let's go to Ariane Bromberg.
Hello, Commissioner. My name is Ariane Bromberg, and I'm a family child care provider in Rochester, Minnesota, and I've been a provider for 25 years.
Great. Well, welcome. Well, with that, I'm going to turn over to the policy director of the Governor's Children's Cabinet, Stephanie Hoganson. Stephanie helps lead this extraordinary multi-agency group that really centers the governor and lieutenant governor's efforts on making this administration that is focused on children's and families. It's based out of MMB, but again, crosses across a bunch of agencies. Both DHS and DEED are honored to be part of it. And Stephanie, thrilled to have you here today to moderate our discussion. So I'll turn it over to you.
Yeah, good afternoon, everybody. It's good to see so many familiar faces and meet a couple of new faces as well. And I just want to reiterate the gratitude to the childcare providers and childcare community for all the work that has happened during COVID to keep providers operating in Minnesota. We have our capacity operating at nearly 100%, where many states are even at half of their capacity or less operating at various points during the pandemic. And so we're so grateful to the hard work and hard work of childcare providers and childcare workers and the communities that have supported them and lifted them up in collaboration with us. So to kick it off, we want to ask a question, particularly to Erin and Scott. Commissioner Grove alluded to the fact that employers talk about the need for childcare every day. Commissioner Harpstead talked about how her own employees, of course, need childcare. So what, Erin and Scott, we know that childcare is on the minds of employers all the time. And what do you hear from employers in your communities, and how are you working together with employers and others in your community to meet those needs? So Scott, I don't know if you want to kick it off, and we'll turn it over to Erin.
Oh, thanks, Stephanie. Absolutely. And even before the pandemic, I said this to anybody who would listen to me, that childcare was the fastest growing economic development issue in our region. And the pandemic certainly exacerbated that and shined a light on it. This is a business retention and expansion issue, workforce recruitment and retention. We continue to hear from our employees, as we have for the past several months, few years. It's impacting their ability to attract talent, especially folks that might have grew up in our region, in our communities, and think about moving back, folks that might want to open a business, and many other life decisions. For us, we absolutely treat this as a business retention expansion issue. We are grateful to the leadership that the private sector is putting forth in this space. A huge shout out to our local chambers of commerce and economic development groups and the Minnesota Chamber for all the time and effort that they're putting into this issue as they hear it from their members and their constituents. But throughout all of Southwest Minnesota, employers, small, medium, and large, are stepping up to the table. We've done a number of community planning efforts in partnership with First Children's Finance and other stakeholders, and the private sector is there from the start through the finish to have the community conversations about what can be done. We are very hopeful for all the conversation that the Family Child Care Task Force had and the legislature's having about new models that will especially impact Greater Minnesota. I realize and fully acknowledge this is a statewide issue, but my lens is Greater Minnesota, and we have a fair number of communities in our region with 3-digit populations. And the ability for the private sector to come alongside, anchor institutions in the community, such as hospitals and nursing homes, nonprofits, faith-based organizations, to bring a solution together. We just are grateful for the continued innovation and conversation around new models and opportunities for invest. And the private sector wants to be there. They want to engage, and they have been engaging for many years. We're very blessed in our region to have private sector such as Little Diggers in Lind, Minnesota, where a business said this issue was so important to their business that they put an on-site facility in themselves, in addition to others that have engaged with their time and their financial resources. So absolutely, this is critical for us to recover as a state and for us to continue to compete globally.
Yeah, and this is Erin. I would echo everything that Scott has said, and he and I have had these conversations. I mean, we're at opposite ends of the state, and we're still hearing the same conversations. One thing I did want to touch on is we're like Scott and in Southwest Minnesota. We've been working with our employers since I've gotten to Greater Bemidji, and that was in October of 2018. We actually pulled a consortium of employers together and just said, how can we come together to increase the capacity for childcare here? And I would say the private sector is very, very receptive, and they want to help in any way that they can. Just the model of having to bring a large center or large capacity childcare to the Bemidji area, which is a regional hub for us too. This isn't even talking about the smaller communities surrounding us. The financial burden and the financial just the startup cost for that, it's really, really taxing, even for the private sector to get involved in. So even if you're thinking of tax incentives for ongoing support for the private sector, they're 100% ready to be there. I think it's just such a huge investment. It's a little scary to put their business on the line for that as well. Although that they see that impact for their employees is necessary for them to be able to operate. And Scott did allude to, I was a parent representative on the DHS Child Care Task Force as well. And there are opportunities within those recommendations to be able to help employers participate in these solutions for childcare within Minnesota. So specifically duty number 5, what's being recommended is actually up to 4 licenses per employer. So they would actually own the family child care license. That would be huge, especially in Greater Minnesota. Right now, they're able to operate 1 as an employer, which Scott had said Little Diggers and there are some other examples throughout Minnesota that have done that. If a business was able to operate 4, that would open up not only for their own employees, but that would be added capacity within the entire community for the entire population. And our employers, public-private partnership is huge in our community in Bemidji area, and they are 100% willing to do whatever they can to increase childcare. That would be a huge benefit. So I urge you to support that as well.
Well, thank you very much for that feedback. I really appreciate that. We appreciate the task force, and I'll make special note of that point. Thank you so much.
And thank you, Erin and Scott. And I'll just acknowledge Erin, Scott, and Ariane, and myself were all members of the Family Child Care Task Force that sunset, and the report went to the legislature in February. So there was a lot of great recommendations brought forward and good relationships built as well, as you can see in this conversations, which is really important. I wanted, after hearing from Scott and Erin, I'm wondering, Jenny, if you would be willing to share a little bit of the story of the Early Learning Center in Spicer that was supported with a DEED economic development grant, and also significant community investment to kind of demonstrate some of the partnerships that Scott and Erin referenced.
Sure, I can do that. We had a committee of people that were working here along with First Children's Finance that were trying to figure out how best to address our lack of childcare in the area. And it was one of those things that, you know, the Y has capacity to run something like that, but the investment up front to actually remodel or build or whatever the facility needed to house that operation what wasn't feasible for us at the time alone. So in January, I guess it was, of 2019, we talked with Representative Baker, and he joined in with us right away, hopped on board, helped lead a fundraising campaign, and we wrote several grants in addition to the fundraising campaign, had support of the EDA and Spicer and the EDC for Candioi County, both contributing as well. There were many private donors involved, and then the D grant of $50,000 that helped us as well. Overall, we raised $826,000 to renovate a space in the mall that was empty. So we tried to use a space that we could revitalize rather than build new and bring new life into that mall. The mall houses a grocery store and a fitness center as well. So we gave parents some ability to have other resources right there by the childcare. And then just lately, a coffee shop went in the parking lot too. So now they can one-stop shop, drive through coffee on their way out. But it was a full community effort to get it done. We had the money raised by August of 2019, and we're able to basically, we called it a wall breaking since it wasn't a brand new building. We went through a wall and started building, completing in December of 2019, right in advance of the pandemic. So we opened and then immediately lost many of our children due to the closures from the pandemic and parents staying home with kids. We did essential worker childcare, like many of the providers I'm sure did on this call, and you know, concentrated on that piece of it as well as all the precautions needed to keep them safe. So that's kind of our story.
That's super great. And I love the kind of one-stop shop as a parent of young children too. I frequent the coffee shop next to my childcare provider and the grocery store because it reduces stress when you're able to get those things done with your kids in care. Lydia, I wanted to turn it over to you, and you also have a pretty unique program that opened during the pandemic. If you could just share a little bit about your intergenerational approach and the fact that you're within a nursing home. I'd love to hear a little bit about your story.
Sure. So we, right next door is Gold Pine Home Assisted Living, and we share the same owners. It would be pretty impossible to do this on our own without having a partnering business. So that's been really critical and important for us to realize. The intergenerational piece is something that isn't necessarily unique to us, but it's unique to Bemidji and came about as a dream and vision from the director of nursing at Gold Pine about 20 years ago. And then within the last 5 years, the owners of the assisted living home decided to add on new units because of the need for assisted living care. And that's how Pine Pals came about. They needed childcare for their employees. And so the idea started out very narrow, very focused on just providing a space for childcare for their employees, for their nurses. And then I got on board with the project in 2017, and we recognized the huge need for childcare in our area. And then I was involved on the Bemidji Area Rural Childcare Innovation Program team with Erin, and just realizing the need for, specifically for infant care. We were able to increase our slots for infants, and right now we're licensed for a total of 96. children, we are at about 75% capacity right now. Full for infants. The other classes are at about 75% capacity right now. And part of that is due to just trying to keep our group sizes a little smaller due to COVID. So the intergenerational piece, it looks different right now than it will in the future, and different from what we envisioned, but we do take the kids over next door and we visit outside the windows. They have an intercom in their window so our preschoolers and toddlers can talk to their grand friends and interact somewhat. We also do art projects and share them. We did an Easter egg hunt. They hid eggs for the kids and were able to watch through the windows. They did something similar for Christmas. They decorated the trees for each other. So the kids did some decorating, and then the residents would come out and decorate at a different time. So it looks very different right now, but we're hopeful that it can be a daily occurrence where we can interact in person every day.
That sounds such an amazing space for both the employees, the residents of the nursing facility, and then an opportunity for the children to have with their grand friends. With that, I'm going to turn it over to Ariane and ask about a little bit more about childcare providers' experience during the pandemic. I know, Ariane, we visited your childcare program last summer, and you serve primarily all essential workers, many of whom work in the medical community in Rochester. How did care change for you during the pandemic, and what did you have to do to adapt?
So starting about a year ago, I started, my families that I serve are, like you mentioned, Stephanie, essential workers. They work at one of the largest healthcare institutions in our state, and they all experience furloughs. So I was navigating, them being put on furlough, and how do I maintain keeping my business open with them potentially looking at furloughs. From the furloughs, as we were ramping up into COVID testing and whatnot, a lot of them were being shifted to different areas, not their usual assigned spots. And a lot of them were having to make hour changes in terms, either first shift, second shift, and whatnot. So that also caused me to extend my hours so I can meet the needs of my families I serve. Along with that, just the added cost of additional supplies in the beginning. It was hard to find supplies, even some grocery items, and all the costs were rising. So combination of furloughs and parents' hours changing and additional cost just all kind of contributed to me always being, cautious of, okay, what's going to be happening tomorrow, and I couldn't look too far ahead. But with some of the public health grants and whatnot, that's helped stabilize, especially the family childcare side of it, because even now we still are facing potential shutdowns due to a COVID exposure, and that's minimum of 14 days being closed. Our income is lost, things like that.
Thanks, Ariane. And I know the public health supports are one way that the state and through administration by the Department of Human Services have invested in childcare providers, and those grants have reached, I believe, more than 8,300 providers since they started last July. And so, and now we're thinking about what we do in the next round of funding with the investment in the American Rescue Plan in childcare. So I wanted to see maybe Lori first, and then Lydia or Jenny, if you have anything to add to kind of how you adapted your programs as childcare centers to meet the needs and public health guidance during the pandemic.
Yeah, thank you. I didn't get a chance to introduce myself, so I'll just do that really quick. I'm Lori Semke I'm the executive director at Mis Amigos Spanish Immersion Preschool. We have 3 preschool childcare centers in the metro area in Hopkins, Golden Valley, and St. Paul. We have a fourth location, a building in Chaska that we have not yet been able to grow into. We had a lot of things put on pause during this time. We have a capacity of 250 kids right now with our 3 locations, and currently we only have 60% of our capacity filled. Part of that is due to our intentionally doing the smaller groups and working in pods like some of the other guests talked about, having intentionally trying to prevent having to close the whole center or quarantine multiple classes. We have had our share of quarantines, and so our focus for the last year has been to stay on top of all of the CDC and MDH guidelines and be ready to inform parents immediately, keep them informed of changes, constantly adapting our policies and procedures. And our team has been very creative in that, in being able to continue to provide the quality of education and nurturing environment that we strive for and that we promise, but with so much different and so many of the things that we cherish, our traditions, having to be completely reimagined. We are a full Spanish immersion preschool, and so 95% of our staff are native Spanish speakers, and so we have kind of a unique workforce to choose from. And I think our biggest challenge, we had many that did, we had to do some layoffs last year. Many also requested a voluntary layoff, and many are back, but we're still, in addition to not having our full capacity filled with students, we also are short on staff, and we're continuing to see just a real difficult time hiring and retaining staff. And there's lots of reasons for that. I am happy to share, but I think I am hoping that part of this discussion will go towards what we are hoping this, the shining the light that you mentioned on it, Scott, that this is really a profession and it needs to be treated like a profession, where we are encouraging young people that that this is a career option. It's not just a job, it is a path for you, and to provide training opportunities, career development, and then support for businesses, so that we can afford to pay them what they deserve to be paid. So I'm happy to say more on any of that, of course.
I think we will touch on the workforce in a minute. I don't know, Jenny or Lydia, if you have anything else to add from your perspective on how you adapted your programs during the pandemic, or how any of the supports helped. And I know Lori too, I know Lori for sure participated, Lydia or Jenny, I don't know if you did, in our vaccination and pilot childcare center testing, COVID-19 testing programs too, that have been able to support providers.
Can I just add one point about that too, that how much we appreciated having the opportunity for early on-site testing and then early vaccination for our staff, because I think staff, mental health has been a big piece of this, with a lot of willing to do it. There was a lot of fear to be on the front lines. And so we are really grateful for the state to prioritize childcare, having that opportunity to test weekly and now every other week for COVID, and to have the vaccination. It's really provided a lot more confidence for our staff. So we're grateful for that.
Well, if you made a good segue, because we would like to talk about the workforce a little bit, Lori, that you started referencing some of the challenges and just the needs of the workforce that I think are pretty unique to childcare. obviously a well-compensated workforce has been a challenge for childcare leaders and their staff. To the childcare providers, and then anyone else who wants to jump in after that, how can we stabilize your workforce? How have the supports provided during COVID? How have those helped? And then what do you need during the next kind of phase of supports and investment to support your workforce and access to childcare? And I want to make sure too, Ariane, I say workforce broadly, including family childcare providers who are mostly sole proprietors or private business owners.
This is Erin. I guess I can speak from the economic development standpoint in that childcare is at the foundation of economic development. So this was an issue before the pandemic, and the pandemic shone such a bright light on this that I feel like we do have to make sure that foundation is strong, and making sure that we have innovative ways for smaller communities and not just a blanket approach to childcare. And the delivery of childcare is going to be so important moving forward. I'm so glad that there's an investment in First Children's Finance to be able to work with the Small Business Development Center going forward now too, to help childcare. We worked with them in the Bemidji area for a Rural Childcare Innovation Program, and one of the things that came forth was a Senate file that was adopted by a legislature, Senator Aki, in our community that we know will work for our community. It's not the silver bullet for Minnesota, but I think that just being available and being able to pivot and look at the model for childcare and see what other delivery systems we could possibly use within especially greater Minnesota is going to be huge in the economy moving forward into the future. If not right now, looking forward into future generations for sure.
Stephanie, this is Scott, and I want to echo everything Erin so wonderfully said. I think there's some very cool things happening with our community and technical colleges, thinking about in Jenny's backyard with Ridgewater College and the program they have there, and some great local mobilization around some scholarships to ensure an adequate workforce. And anything we can do as a broader ecosystem to support scholarship efforts or marketing and recruitment efforts into the industry is huge. And to the point about the amazing family child care providers, the sole proprietors, the single member LLCs, as economic development groups develop programs to provide financial support, that those programs are informed by what the providers need, that they really do lift up the technical assistance piece, as Lori so wonderfully said, that it's treated as any other type of business, and the things around business development are at the forefront to ensure the investments make sense, and that the unique financial needs of childcare enterprises, if you think about loan to values in rural areas or other things like that, that we have terms and conditions that make sense, and that we realize that we continue to push the envelope on that. Was in a meeting a couple of weeks ago, and I won't say it perfectly, but the statement made was basically childcare is the business that ensures other businesses stay in business. And if we keep looking at it with that lens, I think we'll do well.
Scott, this is Commissioner Harpstead. You mentioned in your earlier comments new models often, and I know you mentioned little diggers. What's your favorite new model that you've seen during this time?
I kind of want to echo what Erin had talked about, some of those proposed ones around different ways employers could engage. Are there interesting new models in between what we would think about traditional family child care or center care too? So really just something that would make sense in a smaller community where, it's just a little bit bigger than perhaps what be under a family license, but not quite up to that, full-blown large center. So not to dance around your question, Commissioner, but what I'm thinking about are the proposed ones that just allow something to make sense that's right-sized for that facility and where it could come in. And I think there's a lot of real power either in, the variations on the pod model, variations on the way, employers can hold different licenses, and just kind of something in that middle sweet spot, again, for my 3- and 4-digit population communities especially.
Yeah. And Lydia, of course, mentioned intergenerational, which has great possibilities, something that started with their own staff, but expanded beyond their own staff. And Jenny mentioned a fabulous model of the Y doing something off-site in a different facility and using its nonprofit capacity to stand it up. So thank you for all the ideas you've shared today. Thanks.
Scott or Erin, do you have an example of where you could describe what the pod model is that Scott referenced? Erin and I actually got to take a tour of some before COVID hit. So Erin, I would be eager to kind of make sure folks know what a pod model is and how it works, and and that they exist under current licensing structure.
That is correct. So it is under the special family childcare license section of family childcare. And it's a pod model. So essentially, if you think of a house that had 4 separate rooms, there's 4 separate businesses that are operating under the same roof, but they are separate businesses. So essentially, they're sharing overhead costs and keeping their budget at a more than just a break even. So it makes more financial sense for them to share costs as far as bringing in food, bringing in toiletries, that sort of thing. It can be done. Some of the stipulations that's within the current rules and regulations is the oversight of that and who has the oversight. So if that can be looked into, and that could be an employer versus a CAP agency, which is what it is currently, I believe, that could help a lot. And Jenny, I'm just so jealous of you and what you've done, because that's essentially what we're trying to do here too, is create a Beltrami County Child Care Fund and figure out how you can just layer this with with the public-private sector contributing, because I think everybody sees the value. We need childcare in order to run as an economy.
So to kind of pivot a little bit on childcare running as an economy, one huge component of that is affordability for families. And I thought I would turn this question to maybe Scott and Lori, because I know Lori serves a lot of families who access affordability supports. The American Rescue Plan has several investments in family economic stability, including expanding the child independent care tax credit and the child tax credit, which has the monthly component and the little small boost to that credit for I shouldn't say small, but the additional boost for families with children under age 6. And just when you think about these investments, Scott, and new resources that families will be able to receive, what do you think its impact is going to be on childcare access and affordability? And specifically, if you think there'll be any impact in your community and the conversations you're having?
Lori, do you want to chat first and I'll follow up?
Lori, you're on mute. And feel free, Lori, I know you've spoken to the Child Care Assistance Program too, so you don't only have to speak to the tax credit components, but I just wanted to reference those as well.
Yeah, I might be able to speak more to CCAP and what we see, and also early learning scholarships for families. I think that I know that there are efforts to increase funding to CCAP to get families off the wait list, and that there's been progress. And obviously, we're hoping that there is more. We see also a need just for sort of examining the CCAP process and making it more workable for families, because we really see even families who have already reached the point of being approved for funding struggle to implement it in a way that works for them. You know, we often get contacted by families that have CCAP like the minute they need care, and it's a process, this kind of strenuous process to get them started with care with us. So it seems that every family we work with that has CCAP support is really struggling with getting it quickly and having it work for the program that they want to be in. Also, most of the time it doesn't cover the full tuition rate. So there still is an affordability issue after the highest rate of reimbursement is applied to a lot of centers' tuition rates. And we've seen families have to pass on, maybe Spanish immersion is really what they've wanted for their family, and they feel that we're a great fit for their family, and they have to pass on it because they can't afford the extra rate, or they don't have enough coverage for the full hours that they need during a week. So definitely I'm happy to know that there is a lot of attention being brought to it, and I'm hoping that they're looking at the process and as well as simply the funding.
Thank you very much. I appreciate that. And we're very pleased that the CCAP rate increase is in the governor's budget. But we also have learned so much through COVID about what we could do to simplify so many of the processes we have for signing up for benefits, MFIP and SNAP and CCAP and everything else, that we're really hoping to put all those learnings to work and make all of our services easier to access for Minnesotans. So thank you for that feedback.
Stephanie, Lori said it wonderfully about the process and streamlining it, making it more efficient. And yes, we're very excited about what this additional investment could mean for the families out in our region. I think one point that Lori lifted up about, still not covering enough costs. I'm hoping if something positive would, come out of the conversation, that, the right amount of effort and light would be shined on the mismatch between, the costs of delivering care and, what families are able to afford to pay, and, justifying the importance and the need and the urgency for the public sector to engage. What's government role in programs like this and housing and broadband? We know there's differing opinions on both sides of the aisle, but as we think about the three-legged stool that's needed for greater Minnesota and all of Minnesota to tick, housing, broadband, and childcare, especially so that we have an adequate workforce, the public sector has had to engage. So as we think about the investments that both the state and the federal government are considering right now, it's to ensure all the things we've talked about today: access to quality care, a workforce that's sustainable and paid, and that it can work for all. So I'm hoping that that's an ancillary benefit from the conversations about these additional efforts and scholarships, because we hear from a number of communities where that's such a challenge to retain the workforce and to keep facilities open because of where the marketplace is not working, and where the public sector could come in and provide strategic, targeted, smart investments is where good things will happen.
Very helpful and very interesting conversation today. I've been in a lot of conversations about childcare over the years, and always fascinated to learn from you all. I did want to take a moment to pause. We do have a couple members of the press on the line to see if they had any questions that they wanted to ask. And if the press, they can raise their hands and I can call on them, and I'll keep the conversation going too. I did want to get a chance for folks to weigh in on just generally what are the next needs that the childcare industry and for families will need for childcare access, considering the fact that Minnesota will receive about $537 million, 325 of which is focused on childcare stabilization grants, and the other remaining amount is a pretty flexible pot of resources through the Childcare and Development Fund. So if maybe the providers could start with what they think those resources could do, and I'll also monitor if any press have any questions and raise their hands, make sure to get those questions in. Ariane, would you have any initial thoughts to kick it off?
I do. One of the suggestions or ideas that I have from a family child care standpoint is we've been very blessed and fortunate to receive public health grants, but in a few of the other meetings that I've participated in, one of the ideas that has come up is we currently right now, because we are in a pandemic, we have access to like PPP funds or loans. We also have access, to qualify for unemployment. But coming out of post-pandemic, I'm not sure how long that stuff is going to last. Would there be a way we'd be able to create a pot of money so if a provider is shut down due to like a COVID exposure or other unforeseen circumstances that the provider or she lost a couple families, could they apply to receive some funds to help carry that provider over a period, a period of time, 2 to 4, 6, 8 weeks until she's able to fill again with new children to enroll in the program, in situations like that. The other thing that I think would help, I'm speaking from the family child care aspect alone, is not all of us would be able to qualify for like MNsure. Is there a way we could develop a co-op healthcare program that we could all buy into to help stabilize us as family child care providers? Because that is a big piece to owning our own business, which we're very aware of, is we don't have the benefit package. So that's some of the ideas that I see helping on the family child care provider side going forward.
The access to maybe some sort of a insurance pool would help child-based centers as well. I can confirm it is very hard to find. We really want to offer affordable healthcare options to our employees, and the best we can find is still pretty expensive for them and for us, and with high deductibles. So I think that is a huge missing piece, is helping that this industry just doesn't get viewed. We have to be looped in with health insurance companies as just in the small business pool, and our needs are different. So I'm glad you mentioned that.
Is there one last person who has a final comment on kind of what's next for supports? Jenny, I see you came off mute.
Yes, we are struggling very much so with the staffing piece of it, and just finding enough qualified people to work. It's limiting access because I can't add more children without having more staff, but I have space. So that has been really, really difficult. And just this week, we are sliding our childcare pay scale up to try to attract more. We have extended our reach to colleges within probably 100-mile radius of us to try to advertise through their sites to try to attract more childcare workers to us at this time of year when hopefully some are graduating or after the summer. So I think it's just that next step really is being able to stabilize a childcare workforce, because otherwise we're not going to be able to even fill to our capacity that we already have, let alone build new capacity. So any way we can do that, whether it's through some benefit packages. Fortunately, the Y is a diverse organization, and so we have employees in other areas as well, so we can offer that piece. It's still not as that attractive as a higher wage would be, because many of ours are still on their parents' health insurance. So it's still, how do you balance all of that and really try to attract the best workforce you can to your center?
Can I echo that just from the perspective of a metro area center? We also have the same problem. You would think maybe we would have more, but it really is a nationwide problem. Based on all of our, we work with a big group of childcare providers nationwide, and it is a nationwide problem. And it would be so amazing if Minnesota could be a leader in, I don't know what kind of some type of a really innovative program that could maybe subsidize that extra pay that we need, that we feel we need to pay our staff to keep them stable. We have the same problem with, we wouldn't be able to fill up right now. We wouldn't be able to fill up our capacity because we don't have the teachers yet, even though we are looking and interviewing all the time. So if there's some creative way to help us with just pay in addition to benefits, I'd love to help collaborate on some type of a program.
Well, I'm just nodding in agreement with everything that's been shared, and I really cannot say enough about elevating the profession of childcare and even the language that we use surrounding childcare. Licensed programs in Minnesota are required to have a childcare program plan that revolves around the early childhood indicators of progress. So it is education, but it's not treated like education. 90% of a child's brain growth happens in the first 5 years. So we need to treat it more like education and our childcare professionals as professionals and lifelong learners.
Thank you. This has been such a robust conversation talking about the many of your unique programs, what can be done, where investments have been made, and how we can expand upon those. And I really think the workforce component of the childcare industry is critical. I just want to, I think we could talk for the rest of the day. And I appreciate the conversation and partnership. And I just want to really echo too that part of our state success and our work success really is the collaboration and partnerships with providers and community stakeholders like you all. So commissioners, I don't know if you have any parting comments, but just thank you so much for the great dialogue today.
Yeah, amen. Thanks so much, and for your leadership throughout this last year. It's been extraordinarily important to our whole state. So thank you, and thanks for the ideas and inspiration.
If you get any minutes at all after we get out of this pandemic, you ought to collaborate on a book on business adaptability. It's been amazing what you have done to get through this time. And thank you so much for your input as we start to imagine how we might be able to use federal dollars to invest in this sector. Thanks a lot.
Thank you all.
Well, with that, we'll wrap. Thanks, everybody. Have a good rest of your day. We'll see you.
Thank you.
Bye.